Assalamualaikum warahmatullahi wabarakatuh. Hello, good morning. My name is Hairunisa. I am a midwife. I would like to do a presentation about postpartum care. My presentation lasts about 5 minutes. Okay, let's start. Here we can see definition of postpartum care. Postpartum is the postpartum period that starts from the time the baby is born and the baby placenta is born until the state of the womb returns to the way it was before pregnancy. Period generally occurs around 6 weeks. Okay, next slide. Why is the postpartum care important? Postpartum care will not only speed up the mother recovery and prevent complications after delivery, but will also improve the quality of the relationship between mother and baby and the family in general. The first days and weeks after delivery are a critical phase for the life of both mother and newborn. Most maternal and infant deaths occur during this period, but this is the fact that most people ignore. Research also shows that 2 in 7 women experience depression or anxiety during pregnancy or postpartum care. Fatigue, appetite, or sleep disturbances, mood swings, feeling overwhelmed with caring for a baby, and sexual dysfunction. Okay, next slide. How many visit in doing postpartum care? First visit 6 to 8 hours after delivery. Purpose prevent bleeding in the perineum due to uterine atony. Uh, Second visit 6 days after delivery. Purpose ensure normal uterine involution, uterine contraction, well, a fundus below the umbilicus, no abnormal bleeding or no other. Third visit 2 weeks after delivery. Purpose same as visit 2. And fourth visit 6 weeks after delivery. Purpose first ask the mother about the complication she or the baby is experiencing. Secondly, period counseling for family planning early. Okay, here we can see who is going to handle the postpartum care. The midwife or doctor will plan with the postpartum woman to carry out control or visits, which are carried out at least 4 times, namely 6 hours after delivery, 6 days after delivery, 2 weeks after delivery, and 6 weeks after delivery. Okay. What are the treatments for doing postpartum care? One, adequate rest. Two, don't hesitate to ask for help. Three, consumption of healthy food. Four, do light exercise. Five, wear less and comfortable clothing. Six, keep the vagina clean. And seven, overcoming pain in the vagina and perineum. Let me now sum up. Postpartum care is the postpartum period that starts from the time the baby is born and the baby's placenta is born until the state of the womb returns to the way it was before pregnancy. Postpartum care is important because it will not only speed up the mother recovery and prevent complications after delivery, but will also improve the quality of the relationship between mothers and baby and the family in general. This visit was carried out 4 times during the period. Okay. Uh, in conclusion, I do like to say Alhamdulillahirobbil alamin. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.